Deny, defend, depose understanding healthcare challenges in the United States. Welcome to this important discussion about healthcare in the United States, where we'll break down what deny, defend, depose means in the context of our healthcare system, and why these three words encapsulate so many of the struggles millions of Americans face every day. What does deny, defend, depose mean? First, let's break it down. Deny. This is often the first step in the process. Health insurance companies or providers might deny coverage for necessary treatments, procedures, or medications. This leaves patients scrambling, stressed, and sometimes unable to access life-saving care. Defend. If you challenge the denial, the system is built to defend itself. Providers and insurance companies often justify their decisions with bureaucracy, complex policies, or loopholes, leaving patients in a lengthy, frustrating battle. Depose. For some, it escalates to legal action. Patients may have to go to court to fight for the care they were promised, often against entities with far more resources. This is the harsh reality for many who are just trying to survive. Healthcare in the United States, the big picture. Healthcare in the U.S. is one of the most advanced in terms of technology and treatment options. But access and affordability are constant hurdles. Here are some of the key issues. High costs. Americans pay more for healthcare than any other developed nation, but the outcomes don't always reflect the price tag. Insurance complexities. Navigating insurance coverage is confusing and often feels like an uphill battle. Who hasn't gotten a bill they didn't understand? Lack of universal access. Millions of Americans remain uninsured or underinsured, meaning they don't have access to basic care, let alone specialized treatment. Burnout in healthcare workers. On the provider side, doctors, nurses, and staff face burnout due to understaffing, high demands, and administrative burdens. This affects the quality of care patients receive. Pharmaceutical prices. The cost of medication in the U.S. is staggering, forcing many to ration prescriptions or go without. How does deny, defend, depose affect us? Imagine needing life-saving treatment only to have it denied by your insurance company. Then imagine spending weeks, months, or even years fighting to get coverage, defending your case while struggling with illness. For some, the system is so overwhelming that they simply give up. These hurdles don't just affect patients. They hurt families, communities, and our society as a whole. When people can't get the care they need, we all suffer. What can be done? While the problems seem daunting, change is possible. Here are a few steps we can take as individuals and as a society. Educate yourself. Understand your health insurance, your rights, and how to navigate the system. Advocate for change. Support policies that push for universal access, transparency in pricing, and reduced pharmaceutical costs. Hold companies accountable. Use your voice to demand better treatment from insurers and providers. Support grassroots efforts. Organizations working on healthcare reform need public backing to make meaningful changes. It's time to shed light on the reality of deny, defend, depose, and the toll it takes on everyday Americans. We need to push for a healthcare system that prioritizes people over profits, one where everyone has access to affordable, quality care. Share this video to help spread awareness, and let's start the conversation that leads to change. Together, we can build a future where healthcare works for all of us.